causes include neuropathic pain, chronic musculoskeletal disorders, and fibromyalgia. Chronic pain may lead to sleep disturbances, depression, and impaired daily functioning, highlighting the importance of a holistic approach. Transcutaneous electrical nerve stimulation, or TENS, works by activating large diameter sensory fibers that inhibit pain signal transmission to the central nervous system. This is explained by the gate control theory, where stimulation closes a gate to nociceptive input. It is particularly effective for neuropathic pain and musculoskeletal disorders. Non-opioid analgesics, such as NSAIDs and acetaminophen, act mainly on the peripheral nervous system. NSAIDs reduce prostaglandin synthesis by inhibiting cyclooxygenase enzymes, thereby decreasing inflammation, pain, and fever. They are first line for mild to moderate pain and are preferable in chronic conditions to avoid opioid-related complications. Cardiology. Stable angina presents as predictable chest discomfort with exertion or stress, relieved by rest or nitroglycerin. It is due to transient myocardial ischemia caused by fixed coronary artery stenosis. Key risk factors include hypertension, diabetes, dyslipidemia, smoking, and family history of CAD. Unstable angina occurs at rest or with minimal exertion, often caused by plaque rupture or thrombus formation, and signals high risk of myocardial infarction. Immediate evaluation with ECG and cardiac biomarkers is warranted. Chest pain that improves when sitting up and leaning forward. ECG may show diffuse ST segment elevations and PR depression, which helps differentiate it from ischemic chest pain. Atrial fibrillation MRI often reveals white matter lesions. Rapid ascending paralysis after viral infection suggests Guillain-Barré syndrome, an autoimmune neuropathy affecting peripheral nerves. Respiratory compromise is a major concern, and ventilatory support may be required. The Glasgow Coma Scale assesses level of consciousness through eye, verbal, and motor responses. It is essential for monitoring neurologic status in trauma or critical illness and guides escalation of care. Infectious diseases and respiratory. Tuberculosis treatment begins with an intensive phase using isoniazid, rifampicin, pyrazinamide, and ethambutol for the first 2 months, followed by a continuation phase with fewer drugs. Adherence is crucial to prevent drug resistance and relapse. For pulmonary embolism, nursing priorities include maintaining oxygenation, monitoring oxygen saturation in vitals, administering anticoagulants, early mobilization once stable, and watching for signs of hemodynamic instability or shock. Clinical Pearl.
Action.